সো যা বললাম, তো অ্যাবডোমিনাল পেনের জন্য এই PGE2 মলিকিউল থাকে। এবার আমি বলবো এটার সঙ্গে একটা ক্লিনিক্যাল পয়েন্ট ওরিয়েন্ট করব, যে এই যে PGE2 মলিকিউল থাকে তার জন্য যে পেন হয় তাকে রিলিভ করার জন্য আমরা নর্মালি ফিমেলরা অ্যাসপিরিন খেয়ে থাকে মেনস্ট্রুয়াল সাইকেলের জন্য, যেরকম নন স্টেমুল NSAID বলে, যেটাকে বলে নন স্টেরয়েড অ্যান্টি ইনফ্লামেটরি ড্রাগ খেয়ে থাকে, যেটা এই পেনটাই কমায়। কেন কমায় সেটার কোরিলেশন এখানে আসবে। ওকে, তো এই তিনটে হলো। এবার এই সিরিজ যা যাক, লাইপঅক্সিজেনেস, এটাকে অ্যাব্রিভিয়েট করলে দাঁড়ায় লক্স। এটা কক্স অ্যান্ড এটা লক্স, এবং MCQতে অনেক সময় লক্স ইউজ করে। এখানে দেখতে পাবি যে 5 লাইপঅক্সিজেনেস থেকে প্রথমে হচ্ছে 5-HPTETE, এটা পুরো নাম জানার দরকার নাই, এটা একটা এইকোসনয়েড। আর তার থেকে হচ্ছে 5-HT। ওকে, 5-HTর পুরো নামটা জানতে পারিস, হাইড্রক্সি এইকোসা টেট্রানোইক অ্যাসিড। ওকে, not important. Okay, now from this molecule it is forming LTB4. This is in short is called LTB4. What is that? LTB4 and also forming the LTA4 from this. First actually it is forming the LTA4 directly from 5-HPT, and from that LTB4 is formed, or directly from 5-HT LTB4 is formed. What is this LTB4? LTB4 is also a very potent chemotactic agent. So from previously we know that leukocyte chemotaxis helps, PGD2 helps that, but also this LTB4 molecule is a very potent chemotactic agent. Like PGD2 chemotaxis করে, but major chemotactic চলন যেটা মুভমেন্টটা, that is helped by LTB4 molecule. And from the LTA4 this leukotrienes are produced. This see, you can see this all names are leukotrienes A4, leukotrienes B4, leukotrienes C4, D4, E4. All these molecules are also linked with inflammatory reaction. What is does this? This cause bronchospasm, increased vascular permeability. Okay, so I can just say this and leave, but I need to explain this more. Okay, what happens actually, and what is the clinical importance of this? See, during asthma, okay, asthma, a lot of production of this LTA4, B4, C4, D4 molecules are present. This affect the trachea and also the air passage, bronchus. Okay, when this molecule come in contact with the bronchus, this cause bronchospasm. If someone is already having some problems in his airway, and for this reason he or she can't breathe, now again his respiratory passage is going narrower. So if I draw a rough diagram, like this is a respiratory passage. Okay, and this is the lung, and see, for some reason his lungs are not expanding, there is maybe pleurisy or fibrosis, or some reason he has already problem in breathing. Now due to this infection, more and more production of this leukotrienes molecules are happening, and they are also causing this constriction, bronchospasm. What will happen? He or she will suffer more and more in breathing. That is the asthma. So in the asthma medicine, these molecules are inhibited to reduce the effect, inhibition in asthma to reduce this bronchospasm. Okay, now, and there is also like a increased vascular permeability. I already told what is that. vascular permeability হলো ওই এন্ডোথেলিয়াল সেলগুলো কন্ট্যাক্ট করবে, যার জন্য তাদের ইন্টার এন্ডোথেলিয়াল সেলের যে গ্যাপটা, ইন্টার এন্ডোথেলিয়াল সেলের গ্যাপ হয়তো এই দুখানার মধ্যে, সেটা ইনক্রিজ করবে, যার জন্য নিউট্রোফিল মলিকিউল ক্যান ইজিলি মাইগ্রেট. ওকে, so that is that. Now there is very important, and this question is actually came, okay, this question actually came in our year in 2022 exam. Okay, so it is quite important. What is this lipoxin molecule and how it is produced? You can see from 5-HPTE it can directly produce this pathway and these molecules. But in another pathway, we can use this molecule called 12 lipoxygenase, 12 LOX, and these molecules produce these liposines. Now, why I am saying this is very important? You can see in all these molecule, this cyclooxygenase series or lipoxygenase series, these molecules are all promoting the inflammatory reaction, promoting inflammation. Okay. Now this molecule, as all these are inflammatory molecules, this will increase the inflammatory reaction. Now we know that inflammatory reaction is a protective measure, but if it is happening too much, যদি এটা খুব বেশি মাত্রায় হয়, uncontrolled, that will cause hypersensitivity. Okay, so this kind of problem may arise from it. For this reason, it needed to be checked, it needed to be balanced out. For that, there are various anti-inflammatory molecules. One of them very anti-inflammatory molecules is producing in this cycle. What is this? In this very cycle it is producing, that is this lipoxin molecules. These are anti-inflammatory. So গোটা সাইকেলে যে সমস্ত মলিকিউলগুলো আছে এটা প্রত্যেকটা প্রো ইনফ্লেমেশন, বাট এটা অ্যান্টি ইনফ্লেমেশন. দিস ইজ ভেরি মাচ ইম্পর্টেন্ট ফর ইউ টু নো, বিকজ প্রত্যেকটা মলিকিউল এক কাজ করছে, বাট এটা একটা সেপারেট কাজ করছে. সো এটা খুব ভালো ভাইবা কোশ্চেন আর এমসিকিউ পয়েন্ট হতে পারে. ওকে, so if you see this here, you can see it is inhibiting the neutrophil adhesion and chemotaxis. As I said, the chemotaxis is a very much important part or inflammatory reaction. With chemotaxis na hoy, neutrophil can't migrate properly to the inflammation foci, so that will be not good for the inflammatory reaction. Also, it is inhibiting neutrophil adhesion. What is neutrophil adhesion? In very short, there are two type of neutrophil adhesion. One is called loose adhesion and one is called strong adhesion. What happens in loose and strong adhesion? In case of loose adhesion, see, this is the blood vessel. Here the endothelial cells are present. Okay, and see, this is a neutrophil. Okay, so in case of loose adhesion, some molecules present in this endothelial cells called selectin. There are various parts of selectin like E-selectin, P-selectin. This kind of stuff are present. E for endothelial, P for platelet. These selectin molecules are present over this endothelial cell, and in this neutrophil layer there are some sugar molecules present. Sugar. These are called acyl molecule. Okay, these are actually Lewis X, Silyl X molecule. Okay, these molecules are ligand for this selectin binder receptor, so they can sense presence of this molecule and they bind. Okay, so this binding, if I draw in a separate structure here, this temporary binding, this is not a tight binding, it's a loose binding, cause rolling. Cause rolling of neutrophil rolling, and then it starts to bind tightly. Strong adhesion. How? কি করে হবে স্ট্রং অ্যাডিশন? স্ট্রং অ্যাডিশনের জন্য কিন্তু সেম মলিকিউল দিতে হবে না, তখন এটা নিউট্রোফিল, তখন নিউট্রোফিলের গায়ে কিছু স্পেশাল মলিকিউল তৈরি হচ্ছে. এই মলিকিউলগুলো, এটা হলো ইন্টিগ্রিন মলিকিউল. ওকে, ইন্টিগ্রিন। এই মলিকুলগুলো যেটা রিসেপ্টার, সেই রিসেপ্টারগুলো প্রেজেন্ট আছে এন্ডোথেলিয়াল সেলের উপরে। তো ইন্টিগ্রিন মলিকুলগুলো এই রিসেপ্টারের সাথে বাইন্ড হচ্ছে এবং এটা খুব স্ট্রং অ্যাডিশন, এটা ওটার মধ্যে লুজ অ্যাডিশন না, যার জন্য এন্ডোথেলিয়াল লেয়ারের গায়ে এটে যাচ্ছে। তো যদি এটা এন্ট্রি হয়, সেলটা এখানে আটকে গেল। আটকানোর পর তখন এখানে এই এন্ডোথেলিয়াল সেলের গ্যাপটা বাড়ছে, যেটা বলছে ইনক্রিজড ভাস্কুলার পারমিয়াবিলিটি, যার জন্য এই কোনো গ্যাপটা বেড়ে যাচ্ছে, গ্যাপটা ইনক্রিজ করছে, তখন সেলটা মাইগ্রেট করছে। ওকে, ঠিক আছে। তো এখানে সেটাই কথা বলছে, ইনভিট নিউট্রোফিল অ্যাডিশন, তো অ্যাডিশন বোঝা গেল, লুজ আর স্ট্রং অ্যাডিশন। ওকে, নাও in this whole process, as you can see, there are in this process mainly there is inflammatory molecules or product. These are these molecules. In this molecule I talked about some various chemotactic molecule. These chemotactic molecules are actually called chemokine. Okay, and there is overall this molecule are called cytokine molecule. Okay, and these are particular molecules are called lipoxin molecule, lipoxin. Now in this process, if we somehow inhibit this process, this can cause various effect. So if we use steroid, you know a very popular and common steroid which is produced in our own body. What is that? Cholesterol. Okay, so if we use any steroidal drug, it will inhibit this phospholipase A2 molecule. This will stop this whole cascade, but this is what we don't want. That is why we use NSAID, non-steroidal. This N is for non, S for steroidal, anti-inflammatory. So we don't want inflammation drug. But why we don't want inflammation? I said previously that inflammation is a protective measure. Why we don't want inflammation? A simple reason is that why we don't sometimes want inflammation is inflammation reaction in its own can be quite dangerous. Why? See, in inflammation, neutrophil, phagocytes, these molecules are produced. Macrophage, they engulf cells, engulf microbe or anything which causes the damage, the infection foci. But this molecule can also damage viable tissue. How? We need to know how. For this we need to know how actually macrophages or these cells actually kill this kind of organism. So in basically we know that there is in a cell pseudopodia may be formation, and here may be this infection foci. After the formation there will be this kind of endocytosis happening, endocytosis. And in the cell here is of course the neutrophil is present. I am forgetting to show it, but neutrophil is present. Okay, so after this the infection foci, this infective molecule is present inside this bubble. This is called phagosome. I guess you know this from physiology knowledge. Okay, and in this neutrophil there is of course presence of lysozyme molecule is present here. Okay. From this lysozyme molecule, they will fuse. This lysozyme will fuse with this phagosome and form lysosome, phagolysosome. Here it will be various acid enzyme will be released which will destroy this microbe. But apart from that, there are various ROS, reactive oxygen species will be reactive oxygen species will be released. These ROS are very potent, very potent. killer of micro. What is this and how they are produced? We need to know that also. So what happened? First we need to know what is ROS. As I said, reactive oxygen species. That means any species which contain oxygen, and in this molecule oxygen will be produced, but also it will be very much unstable and reactive. Now if you recall your thermodynamic knowledge, any unstable species, how they they always want to become stable. For that they will react. Now if you recall that in our atmosphere there is something called chain reaction of due to due to CFC molecule in ozone layer. Can you recall it? CFC molecule in ozone layer, in or chlorine molecule in reactive chlorine molecule in ozone layer. What happens in this reaction? In this reaction there is a chain reaction formation. In this chain reaction there are continuously a reactive species which has highly reactive species has high energy, and it is continuously reacting with others, producing more reactive molecules and breaking down ozone layer. This kind of reaction is same thing happening here in this ROS molecule thing. ROS, reactive oxygen species, like O2 radical, OH radical. Here you can see this is the reactive electrons. These free electrons, they are making these molecules highly reactive with hydrogen peroxide. This doesn't have free electron, but it's also a reactive oxygen species. It is highly unstable. This kind of reactive oxygen species are produced. This molecule, as they are very high reactive, they cause cell damage of the microbe and destroy it. So in general, what happens, from oxygen superoxide ions can be produced. From that H2O2 molecule is produced. From that, maybe in one pathway hydroxyl ion is produced. This is actually very potent. Also in other pathway, molecules like hypochlorous acid produced. There are various enzymes in this pathway, like in this SOD superoxide dismutase enzyme is produced. There are MPO myeloperoxidase enzyme is present. This kind of enzyme are present which form this, and this reaction is to OH radical. This is called Fenton reaction. Okay, so this kind of molecules are present, and these are antimicrobial, antibactericidal. They can kill the bacteria. So if as I said, they can kill the bacteria, they can also damage the normal tissue layer too, as they are highly reactive. So what can they do? These reactive species, when they attack normal cell, cause lipid peroxidation. That means breaking of lipid layer. What happens? You don't need to know right now what happens actually. You will learn that in your free reactive species chapter. But in very short, what happens? A reactive species oxygen, like this reactive species, it will react with a lipid molecule and form more reactive species. This species will attack more lipid, will cause more production of this reactive species. Okay, so lipid will break down continuously, and that will cause rupture of cell membrane, and of course oxidate and damage that will proceed. So you can see this, the moral of this whole part is ROS dangerous. That's why we need to control inflammation. Sometimes they go berserk. That means the balance between inflammatory reaction and the anti-inflammatory reaction that got disrupted. If that happens, we need some molecules, some drugs we called NSAID, non-steroidal anti-inflammatory drug. This will stop this inflammation reaction. Why we use non-steroidal inflammatory drug? As we said, if we use steroid, that will inhibit this whole cycle in this layer. So we may lose these good molecules, these anti-inflammatory molecules that are also helping us. We will lose that too. We don't want that. We only want to disrupt this process, this whole portion which is causing this inflammation. We don't want to stop this reaction at all. So we are not stopping here. No, we are not going to stop here. We are going to inhibit in this layer. Okay, in the cyclooxygenase COX inhibitor. Okay, so in cyclooxygenase there are two isomers, COX1 and COX2. In general speaking, COX2 actually produces this anti-inflammatory molecule. pro-inflammatory. এক কথায় যে সমস্ত মলিকুলগুলো ইনফ্ল্যামেটরির সঙ্গে রিলেটেড সেগুলো COX2 বানায়। এবার জেনারেল কোশ্চেন, এখন তো পর্যন্ত সমস্ত মলিকুল বলা হলো সবগুলোতে ইনফ্ল্যামেশনের সঙ্গে রিলেটেড, তো COX1 তাহলে কী করে? না, তা না, প্রোস্টাগ্ল্যান্ডিনের কাজ কিন্তু তো এই কটাতে থেমে থাকে না। প্রোস্টাগ্ল্যান্ডিন যে G2 বা H2, এই যে G2 বা H2, they have others role in controlling the acidic pH of stomach. Acidic pH of stomach. Okay, so COX1 যেটা, this has dual function, physiological role in pH control আর তার সঙ্গে প্লাস inflammation, but COX2 solely inflammation. Okay, so now we can use this NSAID, very popularly aspirin and acidic drug. When we use this aspirin indomethacin, this cyclooxygenase 2 is inhibited. It inhibits both COX1 and COX2. Now, as I said just 5 minutes ago, if we block COX2, then it's good, the inflammation reaction is majorly stopped. If we blocking COX1 and COX2 both, what is the problem? What is the unknown part that I am blocking, that I don't want to block? We are blocking this physiological action also of PG. What is that? pH control. So now the acidity will rise. In gastric mucosa. What will cause? That will cause peptic ulcer. That's why we can't prescribe this NSAID without giving some antacid or kind of thing. Okay, so that is the main problem. So for that, COX2 inhibitors are now marketing, but that is causing another kind of problem. What is that? You can see, as I said, in COX2, inflammatory things will be inhibited. In COX1, both physiological plus inflammatory. Now here you can see, as I said previously, there are two very important molecules, thromboxane A2 and prostacyclin. Thromboxane A2 has the function of clot formation. This is causing clotting. And prostacyclin has anti-clotting. Okay, this balance between thromboxane A2 and prostacyclin is necessary, and all the time this balance is present. But if we disrupt, if somehow this balance is disrupted, if this is reduced, then thromboxane A2 will increase, and this is called clotting production, abrupt clotting production, which that is what we call thrombus. That will lead to thrombosis and may lead to AMI, acute myocardial infarction. Why this will happen? If in coronary artery this thrombosis form, then it will cause AMI. Okay, so we don't want that. Or if we increase this, we decrease this production, we stop it, and prostacyclin G2 is increased, then the clot production will be disrupted. So if an injury, the clot production will not be produced, that may cause severe bleeding. So that's why we need this balance, but sometimes we want to actually disrupt this balance. Why? I will come to this COX-1 part, but first this need to be answered. As I said previously, I can block with aspirin this production of these molecules. Okay, now we need to know one thing. Thromboxane A2, this is produced in platelet. Okay, from the platelet it is directly produced, but prostacyclin can be produced in platelet plus endothelial cells. So if the production of this thromboxane A2 is once inhibited by aspirin, it can't be regenerated again. Why? In platelet, this enzyme is inhibited. It is an irreversible inhibition. So in irreversible inhibition, what we know, that the enzyme is poisoned. Okay, so it is poisoned. It can't work again. So we need to produce this again. But platelet does not have nucleus. Nucleus not present. Nucleus present না। যদি নিউক্লিয়াস না থাকে তাহলে সেখান থেকে ডিএনএ থেকে আরএনএ, আরএনএ থেকে প্রোটিন, প্রোটিন মানে এনজাইম প্রোডাকশন হবে করে। সো নো সেন্ট্রাল ডগমা, সেন্ট্রাল ডগমা not present. I can't produce from here new thromboxane A2. But if I block, in this stage I am blocking, prostacyclin can't be produced from platelet. Okay, that's fine. But from endothelial cells, these are normal cells. This has nucleus, and from nucleus it will from DNA, from to RNA to protein, and that will cause PGI, prostacyclin formation. Now the balance is shifting. Prostacyclin is produced more, thromboxane 2 is produced less. So the chance of clotting is decreased. This is what we actually use during the patient of AMI or myocardial infarction. Okay, so there is the chance of clot formation. We say to take aspirin sublingually. Sublingual means জিভের তলায়, জিভের তলায় সাবলিঙ্গুয়ালি অ্যাসপিরিন রাখা হয়। ধীরে ধীরে সেটা ব্লাডে যাবে, ব্লাডে গিয়ে এই সাইক্লোঅক্সিজেন G2কে, এই সাইক্লোজিনেসকে অফ করলো, যার কারণে এই ব্যালেন্সটা শিফট হয়ে গেল, ক্লট ফর্মেশন আটকে গেল, থ্রম্বোক্সিন A2 প্রোডাকশন কমার জন্য প্রোস্টাসাইক্লিন প্রোডাকশন তাও বেড়ে থাকলো, যার কারণে তোর ক্লট ফর্মেশন চান্স কমে গেল। এটা একটা। এবার আমি এটা এখানে যেটা বলা হচ্ছিলো যে এটা অ্যাসপিরিন দিয়ে হতে পারে, এর সঙ্গে সাইড ইফেক্ট কী হবে, অ্যাসপিরিন দেওয়াতে পিএইচ কন্ট্রোল যেটা প্রোস্টাসাইক্লিনের জন্য জিআইটে সেটা লস্ট হবে, যার কারণে ওখানে অ্যাসিডিটি প্রোডাকশন বেড়ে যাবে, দ্যাট মে কজ পেপটিক আলসার। বুঝে গেল তো? ওকে, এবার নাও যদি এখান থেকে প্রবলেমটাকে আটকানোর জন্য কেউ ভাবলো যেহেতু COX-2কে আটকাবো, কারণ COX-2তে ইনফ্লেমেটরি মলিকুল তৈরি হয়, এগুলো সব তৈরি হয়, তো COX-2কে আটকাবো, দ্যাট ক্যান বি ডান। But if I just stop this COX-2 molecule, COX-1 is also producing some inflammatory reaction too. So that also causes the change of the balance between the prostacyclin and thromboxane A2. And surprisingly, it is seen that in that case, the actually thromboxane A2 level increases and prostacyclin level decreases. So more production of AMI will happen. So COX-2 inhibition is not a possible solution right now. In future, maybe drugs are present which can selectively trigger and off just the thromboxane A2 molecule. But right now, there is no particular inhibitory molecule which will just directly cause the inhibition in this. So you can see this is a very much opportunistic site of research where we can make this kind of inhibitor which will directly act on thromboxane A2 and does not affect this prostacyclin molecule. Okay, so that is one thing. There is, as I said, another kind of inhibition. This is the 5 lipoxygen inhibitors. These are the used in the asthma. As I said, this lipoxygen leukotrienes molecule, they are the causing of the bronchospasm. So if we decrease this, like decrease this asthma, we use this kind of molecules. Another thing, this 5 lipoxygen, this can be stimulated by increasing of fish oil. So lipoxygen will be produced more. Lipoxygen are as anti-inflammatory, so it will reduce the inflammatory reaction too. Okay, so yeah, basically this is the session. It's quite a long video, I guess. You may find it boring, but try to listen it and give me feedback how it is. My English is quite poor actually, so my pronunciation and my grammatical errors should be um, pardoned, but I am trying my best. Okay, so this is actually for my own revision and for your, to give you a basic idea how this inflammatory, how this pathology and immunology and also biochemistry can be integrated. Okay, goodbye.